Welcome. My name is Anja Christoffersen and I'm from Champion Health Agency. And I have the pleasure of walking you through an introduction to consumer and community engagement. I first came in contact with the Continence Foundation back in 2018 when I shared my story of living with lifelong fecal incontinence with Bridge magazine. Ever since, I've worked with the Continence Foundation in a range of capacities and am currently on their Consumer Advisory Committee and their Policy Advisory Committee. I have the pleasure of sharing with you a little bit more about consumer and community engagement over the next few modules. So before I go any further, I'd like to do an acknowledgement of country. So the Continence Foundation of Australia acknowledges the traditional custodians of country throughout Australia and their continuing connection to land, sea, and community. We pay our respects to elders past, present, and emerging. I'm on Cubby Cubby land up on the Sunshine Coast where I'm recording from today. So in this session today, we're going to talk a little bit more about what is a health consumer, what is lived and observed experience, what does a consumer representative do, how you can contribute your experience, what consumer engagement in Australia actually looks like, some of the levels of engagement, how does the foundation engage consumers, and some of the consumer representative roles and responsibilities at the foundation. So we do have some learning outcomes. So hopefully when you finish this presentation, you'll be able to understand the role of a consumer representative, the context of consumer engagement in Australia, the levels of consumer and community engagement using the IAP2 spectrum, which is the International Association of Public Participation spectrum, and also understand how the Continence Foundation engages consumers and how you can be involved. So you can come back to this slide afterwards if you wish. So first of all, what is a health consumer? So there are so many different words that can be used to describe people like me who have lived experience of incontinence or have accessed health services. So we understand that the term consumer may not be something that everyone identifies with. They can be called consumer advisors or people with lived experience consultants. There are a million different terms under the sun, but just for this presentation, we've chosen health consumer as it is what is most commonly used. So health consumers are broadly defined as people who use health services as well as their family and carers. So looking a little bit further into that definition, the foundation is interested in partnering with both consumers and carers. So consumers are people who use or are potential users of the foundation's services, including their families and carers. So potential users of the foundation services do refer to the broader community who do not have lived experience of incontinence. So you can really be anyone as a potential user and you still have an incredibly valuable perspective. So carers are any people who provide unpaid support to someone with incontinence. So this definition, it's not restricted by age or gender or relationship to the person that you provide support to. So often as a carer, you may not recognize that you're a carer, as it might just be to someone that you love, that you just support. But a lot of the time, you have such a valuable perspective that you can actually bring to this work. So lived and observed experience are also terms that can be thrown around in this industry. And it can really narrow down what, an organization like the foundation is looking for when they're actually wanting to engage someone in their perspective. So lived experience is a term that I really identify with, and it basically describes the knowledge and expertise acquired through something that you experience yourself. So observed experience is something a bit different. So it's a knowledge and perspective acquired through supporting someone with lived experience. So it might sound a little bit confusing. So we'll go through a few examples. So for example, someone with incontinence like me would have lived experience of incontinence. But someone who's a carer for someone with incontinence would have observed experience of incontinence, but they would have lived experience of being a carer. So the lived experience of being a carer, of course, would be very important when inputting into carer-oriented work or resources. So what does a consumer representative do? This is very, very broad once again. But just to narrow down the essence of what we do, I love the term nothing about us without us. It can be wildly overused. If you haven't heard of it, lucky you, because it's a beautiful saying. It came about in the 1990s in the disability rights movement in Africa. And it basically talks about how when a decision affects you, you should be part of making the decision. And I think that's really at the essence of what consumer representative work is about, because you deserve that place at the decision-making table or being able to influence, what you're doing that affects, your life or the services that you're offered. So as a consumer representative, you're there to provide your perspective on behalf of consumers. So while you may have a lot of professional experience and life experience, and this is so valuable to be able to bring as well when you're coming as the whole person, you're not expected to know, a lot of things. You're just expected to be there for your lived experience, because that is really the most valuable thing that you can contribute. And having an understanding, if you do, of other consumers' experiences as well can be really, really helpful. Being able to connect through human experience is so important. So often organizations, not just the foundation, do have a lot of research and data that they have access to, but you being there to actually tell a personal story and to contextualize that data with empathy can be really, really powerful and can be what actually changes people's perspectives. It's like a hearts and minds campaign. Centering the voice of consumer and community. So making sure that that voice of the consumer is at the forefront of all decision making and at the forefront of meetings or document review or whatever you'll be doing. How does this affect consumers? How does this make it different? How can you look at things differently? And you're there to highlight a different perspective. So that really comes in with, you're not there to be a yes person. Like, of course, if you agree with what people are saying, definitely say yes and validate that people are on the right track. But you're there to actually say, this is what works for me and my community, and to provide that different perspective. But you're also there to really have an impact. So I think it's important to actually take time to reflect on, why are you here? Why is it important that you are doing this consumer representative work? How does it align with your personal goals and your experiences? So how you can actually contribute your experience. So of course, with incontinence, it is something that's incredibly personal. It took me many years to actually openly admit that I had incontinence and to understand that this bowel leakage that I'd experienced my entire life was incontinence. So it is raw and it is personal. So it's really completely up to you how much you disclose about incontinence or about anything. And you're the one that sets your own boundaries to keep you safe. So try and take some time to reflect on your experiences and any that have been told to you by your community or friends or family. So you're prepared to give your feedback and advise when asked in a way that is safe for you. So if you don't feel comfortable about the specifics, you can definitely de-identify it or just draw on key parts of the learnings. So actually think about some prompts for thoughts and ideas or examples so they're ready for you when you engage. You can think about different experiences at different times or any key turning points. So for example, when you first experienced incontinence, how did you feel? What were the barriers? Who were the first people that you talked to? How did you seek help? When did you decide to seek help? What did you find the most useful thing? What did you wish other people understood? And also think about the different positives or negatives or things that could be made better. Did you find, the management techniques okay? Were you able to access your consumables okay? Did you find it really difficult to communicate it with your healthcare professional? How could that be made easier? So consumer engagement in Australia, it may be new to you, or you may be have done this for a long time, but it's actually existed for a really long time and a lot longer than I knew that it existed. So there are a lot of relevant regulations and requirements and guidelines out there. And probably the most well-known is the National Safety and Quality and Health Service Standards. And they have 8 standards, but the first 2 standards are basically underpin all the rest. And standard 2 is partnering with consumers, which basically talks about partnering by the bedside in like shared decision making and being a partner in your own care, but also talks about partnering all the way to the boardroom, so in service delivery and governance and how the services are designed. So this has really set the tone across many different areas, from research to mental health to clinical governance to really everything, really wanting to engage consumers a lot more, and community services as well. So people are really trying to move more to actually engage consumers. So everyone does things differently, so there's no consistent approach. So if you're a consumer with one organization, it'll be quite a different experience being a consumer with a different organization. And there's no real right or wrong. Only you can judge what's right or wrong for how you want to engage. If you're a bit confused about how you're being engaged, or you're not sure if it's what you want, or you have any questions, it's really important that you go to the organization that you're engaging with and you have a conversation with them. But if you're needing additional support like training, there are a lot of peak bodies that actually look after consumers that can provide you with these resources or trainings. And there are health consumer peak bodies. So I'll include them on a resources slide at the end of this training, but we have a national body, and we also have bodies in all of our states and territories except South Australia and Northern Territory. So in terms of our levels of engagement, as I mentioned at the beginning, there's an association called the International Association of Public Participation. And they've developed this spectrum to help guide us on the different ways that we can actually be engaged in decision-making when we're being involved in the whole nothing about us without us engagement idea. So from left to right, it's about increasing our impact on the decision. So up the top, you can see our public participation goal, and down the bottom, the promise to the public. So in form, it's really just about providing us information. The promise to us is just that we know. And then you can see consult, that we're giving feedback, and that the promise to us is that we'll be informed and we'll have our concerns acknowledged, and that there'll be feedback back to us on how we influence the decision. The involved area is where we're worked with and where our concerns and aspirations are addressed, and they're understood and they're considered. And so the promise to us is that we will be worked with, and that our aspirations will be reflected in the alternatives that are developed, and there'll be feedback on how it's been built into the decision. Collaborate is really where this term co-design comes in, which you may have heard of before. And that's really where you look at that equal power and that equal decision making. So we'll be part of the advice and innovation and forming the solutions together. And we'll be involved in decisions to the maximum extent possible. And then moving down to the empower stage, where we'll actually be providing the information, we'll be making the final decision, and what we decide will be implemented. So there's no right way to engage, there's no right level to engage, but it's important that you have a discussion about where you'll be engaging. So you don't think that you're being engaged at the collaborate level, expecting to be making the decisions, but you're actually not having that decision-making power. Or you think that you're just giving an idea and then suddenly you're the one making the decision and you're not ready for that. So it's really important to have these transparent discussions, so you have the right expectations of the work that you're doing. So the foundation works with consumers in a lot of ways, and there are a lot of areas of the foundation. So there is a Consumer Advisory Committee, as you can see on the side, the CAC, the CAC. So I am a part of this committee, and it's an elected committee that feeds back directly to the board of directors. But we also have a group of consumers that actively participate in the foundation's work. So you can see here that they all interlay with the different areas and services, from clinical services to policy and research to education, information, health promotion, marketing and comms, and aged care reform. So each of these divisions actually feed back up to the senior management team that then feed back up to the board of directors. So it's really important that we have consumers who do actively participate in all areas of work. And then we do have consumers that do directly communicate with the board as well. So consumers do participate in a range of ways in the foundation's activities. So one of the ways is that we review and provide feedback on the Foundation's brochures and booklets, videos, webinars, and social media content to make sure that consumers actually find it engaging and it's working for us. We understand it, we find it attractive, the language that's being used is right, the pictures look good. The second is we participate in advisory, reference, working groups and committees. So this will usually be with a group of people from the Foundation. There may be another consumer on board, and it's usually they give us, set times that work for us, and we meet with them, and then we can have quite open discussions and work towards a project or a goal together. The third way is to contribute our lived experience to Foundation publications, videos, conferences, and health professional education resources. I've been a part of all of these things, and it's always so wonderful to partner with a foundation in this way, as these opportunities are really, really good for storytelling and being able to share your lived experience. The fourth way is participating in projects and campaigns, such as being able to journey map a consumer's journey. It might be through the health system or in accessing care, and also in aged care reform. So this might be a bi-monthly consumer discussion meeting for several months. So in addition to that, consumers have a lot of different roles and responsibilities in the Foundation. So one of them is to provide insight into incontinence and its effects on daily living. So that's part of, our perspective as a consumer, I guess, that we can really provide and give that insight. We also give recommendations on behalf of other consumers to improve the incontinence information, support treatment and care. We can advocate on behalf of people experiencing incontinence, support the Foundation's vision and mission, as well as their campaigns and activities, give feedback and recommendations to improve the services, and also provide media interviews if we're comfortable. So we do have some references here if you're interested in looking into the Partnering with Consumers standard, or looking in more to what is a health consumer, who is a health consumer, from Health Consumers New South Wales site. And here we do have some resources that will be provided to you as well in link, or that you're able to Google. So these are our peak bodies, and here is also the International Association of Public Participation spectrum with those engagement levels. So thank you so much for joining me today. It's been an absolute pleasure to spend this time with you, and I really look forward to joining you in consumer work in the Foundation sometime very soon.